You're not qualified for this surgery. Step aside. The words sliced through operating room 7 like a scalpel through flesh. Dr. Ronan Blaine didn't even glance at the monitors showing the patient's plummeting vitals as he spoke. His eyes stayed locked on Dr. Darius Voss, the black surgeon whose gloved hands had been reaching for the bypass equipment. "The patient is coding," Dr. Voss replied, his voice steady despite the alarm bells screaming through the surgical suite. "We have maybe minutes before irreversible brain damage." Blaine moved between Voss and the table, physically blocking access to the dying patient. "Then I'll handle it. You can observe. This is a level 5 cardiac emergency, way above your skill set. Have you ever watched someone judge your worth in the seconds between life and death?" Dr. Darius Voss stood in his blood-speckled surgical scrubs, his years of cardiovascular expertise reduced to nothing in Blaine's dismissive stare. Behind him, 2 surgical nurses exchanged uncomfortable glances. The anesthesiologist, Dr. Alara Kim, kept her eyes on her monitors, unwilling to enter the battlefield erupting around her patient. "Dr. Blaine," Voss said quietly, "I've performed this procedure hundreds of times with a high success rate. The patient needs a modified Cabrera bypass with simultaneous valve replacement. You requested my consultation specifically because administration forced you into this case." Blaine's voice carried the casual cruelty of someone accustomed to being obeyed. "We all know how you got your position here, Voss. Diversity quotas, not talent." The surgical nurse closest to Voss, Nova Sanos, a veteran, actually gasped, but she didn't speak up. None of them did. Minutes until brain death. "Sir," Voss tried again, his composure unshakable despite the rage that must have been boiling beneath his calm exterior. "We're wasting critical time." "Then stop wasting it and get out of my OR." Blaine turned to the surgical team, his white hands already reaching for instruments. "Prep for emergency bypass. Standard protocol. We'll handle this the right way." Voss didn't move. His dark eyes shifted to the monitors, reading the cascade of numbers that told the story Blaine refused to see. The patient, Caden Williams, a father of 3, was deteriorating faster than any standard procedure could address. "Doctor Blaine, with all respect, standard protocol will kill this patient. His arterial structure requires out now." But Darius Voss had spent his entire career being underestimated. Today would be different. He took one step backward, then reached into his scrub pocket and pulled out his ID badge. Not the one clipped to his chest, but the leather wallet he kept in his left pocket, the one most people never saw. "Before I leave," Voss said, his voice still deadly calm, "I think you should know who's about to file the formal surgical objection that will be reviewed by the medical board." He held up the wallet. "Board of directors, medical staff." The operating room went absolutely silent, except for the shrieking alarms. Blaine's face went from confidence to confusion to horror in the span of seconds. You're not. I'm the chief of this department. I've been chief for years. I was performing this exact surgery at Johns Hopkins while you were in medical school." Voss's voice never rose above conversational, but every word landed like a defibrillator shock. "And right now, my patient is dying while you play hierarchy games you don't understand. Minutes until brain death. The admin never said." Blaine's hands had frozen over the surgical tray. "The administration assumed you read patient files. This is a VIP case. Caden Williams is a state senator. His wife is in the consultation room with our hospital president right now." Voss moved around Blaine with the practiced efficiency of someone who'd spent thousands of hours in operating rooms. "Which means when this patient dies, Because you refused to let me operate, you'll be explaining to the governor's office why you blocked the surgeon they specifically requested. Alara Kim, the anesthesiologist, spoke for the first time. Vitals are crashing, BP low and dropping. Doctor. Santos, Voss commanded, his voice shifting into the tone of absolute surgical authority. Bypass circuit now. Dr. Kim, prep for emergency cardiac arrest protocol. Dr. Blaine, he paused, gloved hands already working with muscle memory precision. You can observe. This is above your skill set. But the damage was already done. And Darius Voss never forgot. What happens next will leave you speechless. Dr. Voss's hands moved like they were choreographed. Every motion precise, minimal, perfect. The modified Cabrera bypass he'd mentioned wasn't in any textbook. He'd pioneered it himself after losing 3 patients to conventional methods during his residency at Hopkins. Clamp, he called, and Nova Santos placed the instrument in his palm with the practiced synchronicity of a surgical team that had worked hundreds of cases together. Blaine stood frozen near the wall, his earlier confidence replaced by the dawning realization of what he'd just done. Doctor? Voss, Blaine said without looking up from the bypass graft he was suturing. Since you're here, take notes. This technique will be published in the Journal of Cardiac Surgery next month. The modification saves approximately more patients than standard protocols in cases of complex arterial damage. Minute until brain death, but Voss wasn't counting anymore. His fingers worked through tissue planes that other surgeons couldn't even see. The valve replacement that should have taken minutes happened in minutes. Santos, prep for chest closure. We'll keep him on bypass for another minutes while the grafts settle. The surgical suite's atmosphere shifted from crisis to controlled procedure, but the tension remained thick and unspoken. Blaine finally found his voice. Dr. Voss, I had no idea you were the person you've been dismissing at surgical conferences for years. Voss's hands never stopped moving. The one whose research you cited in your last grant application without credit. The chief who's reviewed your surgical outcomes and found them adequate. Every word was a surgical strike. I need to apologize. You need to be quiet. Voss's tone wasn't angry. It was worse. It was disappointed. You need to watch me close this chest. You need to understand that your assumptions almost killed a man whose heart I'm currently restarting. And then you need to decide whether you want to continue your career at this hospital or anywhere else. But here's what Darius Voss hadn't told anyone in that room. As he placed the final suture and stepped back to let the closing team take over, Voss's phone buzzed in his pocket. The text was from Leora Williams, the patient's wife, who happened to also be sitting in the hospital president's office with 3 other people, the hospital president, the state attorney general, and a civil rights attorney from the ACLU. Because Caden Williams wasn't just a state senator. He was the chairman of the Healthcare Oversight Committee currently investigating systemic bias in medical treatment. His random heart attack at St. Catherine Medical Center wasn't random at all. It was a test case. And Ronan Blaine had just failed spectacularly on camera. Every operating room at St. Catherine was equipped with recording equipment for training and liability purposes. Everything Blaine said, every dismissal, every racist assumption was documented in a high-quality video with perfect audio. Voss pulled off his surgical gloves and dropped them in the medical waste container. Doctor, Blaine, you should know that this surgery was requested by the State Healthcare Commission as part of their investigation into treatment disparities. They specifically asked for you to be called in as the attending surgeon to see how you'd respond to my presence in the OR. The color drained from Blaine's face so quickly he might have needed his own cardiac workup. What? This was a setup. This was documentation. Voss's voice remained clinical. The patient is real. The heart attack was real. The surgery was real. The only thing that was orchestrated was giving you the opportunity to demonstrate the same bias that's been complained about by black staff and patients for the past years. Seconds of racism documented forever. You can't do this. This is entrapment. This is accountability. Voss walked toward the OR exit, stripping off his surgical gown as he moved. The medical board will review the footage. Human Resources will review it this afternoon. The Healthcare Commission will review it as part of their federal civil rights investigation. He paused at the door. And Dr. Blaine, that research you cited in your grant application, the Voss modification for complex bypass surgery. I'm the Voss. It's named after. The paper you plagiarized was mine. That case is also under review. Minutes later, Dr. Darius Voss walked into President Serena Chen's corner office, still wearing his surgical scrubs. The blood had been rinsed away, but the weight of what just happened hung on him like a lead apron. Leora Williams stood when he entered, her eyes red, but her composure intact. Dr. Voss, Caden, stable, in recovery. The surgery went perfectly. He'll need weeks of cardiac rehabilitation, but his prognosis is excellent. Voss's medical voice was soft, reassuring. You can see him in about an hour. She nodded, then turned to the three other people in the room. This is the surgeon who saved my husband's life and the chief of surgery who's been documenting bias in this hospital for years. President Chen stood as well, her expression unreadable. I agree. Voss sat down without being invited. A subtle power move that didn't go unnoticed. Dr. Ronan Blaine just demonstrated on camera exactly what the Healthcare Commission has been investigating. Systemic bias in medical treatment based on race. The Attorney General, Harlan Morrison, a sharp-eyed black man in his 50s, opened a laptop. Dr. Voss, we've been reviewing the OR footage in real time. What you witnessed was attempted murder, Voss replied bluntly. Dr. Blaine blocked me from performing emergency surgery on a coding patient because he assumed I wasn't qualified. His assumption was based solely on my race. Chen's hands were shaking slightly. Dr. Voss, you could have identified yourself immediately. Why didn't you? This was the moment Voss had been waiting for. Because identification shouldn't be necessary. My qualifications were already in the patient file. My surgical history was already in the hospital database. Dr. Blaine called me into that OR specifically because this case required my expertise. But when he saw me, every credential disappeared. All he saw was a black man who couldn't possibly be competent. The ACLU attorney, Aria Jang, was taking rapid notes. Doctor, Voss, how many times has this happened to you personally? Documented incidents to other black medical staff at this hospital. We've documented incidents of racial bias, ranging from assumed incompetence to outright discrimination in assignments and promotions. The numbers hung in the air like a diagnosis no one wanted to hear. Incidents, Morrison repeated slowly. And the hospital's response? Chen shifted uncomfortably. We've had sensitivity training, which Dr. Blaine attended twice. Voss pulled out his phone and displayed a document. I have the attendance records. He signed in, sat in the back, and spent both sessions on his phone. No one enforced participation because he's a valuable surgeon with a strong track record. His track record. Aria Jang's voice was sharp. Dr. Voss, we've been reviewing outcomes data. Can you explain why Dr. Blaine's black patients have significantly worse outcomes than his white patients? Here's where it gets really interesting. Voss opened his briefcase. Yes, he'd brought his briefcase to a surgery because he'd known this moment was coming, and pulled out a thick binder. Dr. Blaine's outcomes data shows a higher mortality rate for black patients compared to white patients undergoing identical procedures. His post-operative complication rates for black patients are higher. His surgical times for black patients are longer, suggesting less careful technique. He slid the binder across the desk to Morrison. I've been documenting this. I submitted formal complaints to the medical board. They were dismissed as insufficient evidence of intentional bias, because implicit bias is legal, Jang said grimly. Unless we can prove intentional discrimination, which is why I needed today's footage. Voss's voice was quiet but carried absolute certainty. Dr. Blaine didn't just demonstrate implicit bias, he explicitly stated that I got my position through diversity quotas, not talent. He physically blocked me from treating a dying patient. He prioritized his racist assumptions over patient survival. That's not implicit bias, that's attempted murder. Chen looked like she might be sick. What happens now? Morrison closed the laptop. Now, Dr. Blaine's medical license will be suspended pending investigation. St. Catherine Medical Center will be subject to a comprehensive federal civil rights audit. Every surgery, every patient outcome, every staffing decision will be reviewed. And if we find systematic discrimination, Jang added, St. Catherine will face federal sanctions, including potential Medicare funding suspension. We're talking about millions annually. The hospital could close entirely. Chen's voice was barely a whisper. What can we do? Voss leaned forward. What you should have done when I first reported this. Immediate termination of Dr. Blaine with cause. Mandatory bias training for every staff member with real consequences for non-participation. An independent review board with enforcement authority. A formal apology to every black staff member and patient who's experienced discrimination here. And, Morrison prompted, and you give me full authority to rebuild this cardiovascular department with a zero-tolerance policy for bias. I'll recruit the best surgeons in the country. Black, white, Asian, Latino, it doesn't matter. Only competence matters. Only patient outcomes matter. Months later, what happened next changed American healthcare forever. Dr. Ronan Blaine's medical license was permanently revoked after the investigation revealed not just bias, but actual evidence of deliberately substandard care for black patients. His career was over, his reputation destroyed, but he was just the beginning. The federal audit of St. Catherine Medical Center uncovered systematic discrimination in hiring, promotions, patient assignments, and surgical scheduling. Other doctors were disciplined. Some were terminated. The hospital paid millions in settlements to affected patients and staff. Dr. Darius Voss became not just chief of cardiovascular surgery, but chief medical officer of the entire hospital. His first action, implementing the Voss Protocol, a comprehensive system for tracking and eliminating bias in medical care. The protocol included blinded patient record reviews, removing racial identifiers during initial assessments, mandatory implicit bias testing for all staff, real-time outcome tracking by patient demographics, third-party oversight committees with enforcement authority, automatic investigation triggers when outcome disparities exceeded a certain percentage. Within months, patient outcome disparities dropped significantly. Black patient mortality rates fell to match white patient rates for the first time in the hospital's history. But Voss wasn't satisfied. He took his protocol national. Medical centers adopted the Voss Protocol in the first year. The American Medical Association made it recommended practice. Medical schools began teaching it as standard curriculum. Years later, a study published in the New England Journal of Medicine showed that hospitals using the Voss Protocol had fewer racial disparities in patient outcomes compared to hospitals without it. Darius Voss had done what a few people ever accomplish. He'd transformed personal discrimination into systematic change that saved lives across an entire nation. Today, Dr. Voss stands on the stage at the National Medical Conference addressing thousands of physicians. His presentation isn't about surgical techniques or medical research. It's about the times he was told he wasn't qualified. The moment Dr. Blaine blocked me from that operating table, he wasn't just discriminating against me. He was risking a patient's life because his racism was more important than his medical ethics. The audience is silent, uncomfortable. Good. How many black patients have died because doctors assumed we couldn't be competent? How many Latino patients? How many women? How many people whose lives could have been saved if healthcare professionals checked their bias at the door? He clicks to the next slide. It's the OR footage from that day. Blaine's voice echoes through the conference hall. You're not qualified for this surgery. That patient lived because I didn't need Dr. Blaine's permission to be qualified. But every day patients die because doctors make assumptions based on race, gender, accent, appearance, assumptions that override training, evidence, and ethics. The next slide shows mortality statistics. The disparities are staggering. The Voss protocol isn't just about diversity. It's about survival. It's about medical competence. It's about honoring the oath we all took. First, do no harm. The standing ovation lasts minutes. In his office, Dr. Voss keeps a letter framed on his wall. It's from Nova Santos, the surgical nurse who witnessed everything but said nothing that day. Dr. Voss, I've been a surgical nurse for years. I've seen bias. I've seen discrimination. I've stayed silent because I was afraid of losing my job, my career, my stability. Watching you that day, watching you stay calm, stay professional, stay focused on saving the patient even while being humiliated, changed me. You showed me that courage isn't about being fearless. It's about doing the right thing, even when you're terrified. I've reported incidents of bias since then. I've spoken up in surgeries where I saw concerning behavior. I'm not silent anymore. Thank you for showing me what integrity looks like under pressure. Nova Santos, RN. Below the letter, Voss keeps a newspaper clipping. The headline reads, Hospital nurse wins National Award for Patient Advocacy after documenting systemic bias in medical care. Nova Santos went on to become the director of patient safety at St. Catherine. Under her leadership, the nursing staff created their own protocol for identifying and reporting bias in patient care. Change doesn't happen because one person is brave. It happens when one person's courage gives others permission to find their own. Caden Williams, the state senator whose random heart attack started everything, sits in his home office recording a video message that will be played at medical schools across the country. When I volunteered for this case, I knew the risks. I knew that if something went wrong during the surgery, if Dr. Blaine's bias caused a complication, I might not survive. He pauses, emotional. But I also knew that if I didn't volunteer, thousands of other black patients would continue dying from preventable complications because doctors didn't believe they deserved the same quality of care as white patients. Dr. Darius Voss saved my life that day, not just by performing the surgery, but by refusing to accept discrimination even in a life or death situation. He could have walked away. He could have let Blaine try and fail. He could have protected himself, but he protected his patient instead. That's what doctors are supposed to do. That's what the Voss protocol ensures they will do, not because they're saints, but because the system now makes it impossible to let bias override medical ethics. The video ends with Caden standing next to Dr. Voss at a hospital dedication ceremony. The new wing, the Voss Center for Equitable Cardiac Care, opened. It's the first facility in the country built specifically to eliminate racial disparities in heart disease treatment. Dr. Darius Voss's story isn't just about one surgeon's triumph over racism. It's about how systematic change happens when people refuse to accept injustice. But here's what most people miss. The Voss protocol only works because ordinary people, nurses, technicians, administrators, patients, use it. Every time someone reports a bias incident, the system gets stronger. Every time someone speaks up instead of staying silent, another life is saved. Have you witnessed bias in healthcare? In your workplace? In your community? What did you do? The difference between Caden Williams living and dying was seconds. Seconds where Dr. Darius Voss refused to be silent, refused to accept being dismissed, refused to let racism override his responsibility to his patient. Seconds of courage can change a lifetime. What will you do with your seconds? Years after that surgery, Dr. Voss received a letter from a medical student at Johns Hopkins, his alma mater. Dr. Voss, I'm a first-year medical student. I'm Black. Last week, during my first clinical rotation, an attending physician told me I should consider a less challenging specialty because students like me often struggle with the pressure of surgery. I went home and watched your National Medical Conference speech. I read about the Voss protocol. I learned about what you did. Today I reported that attending physician to the medical school dean. I'm staying in surgery, and someday I'm going to be the kind of surgeon you showed me was possible. Thank you for refusing to be silent. Future Dr. Harlan Richardson. Voss keeps that letter in his desk drawer. On hard days, and there are still hard days, he pulls it out and remembers why he fought. Not for recognition, not for revenge. For every Harlan Richardson who needs to know that their dreams are possible. For every Caden Williams who deserves equal care regardless of their skin color. For every future patient whose life might be saved because one surgeon refused to accept that racism was more important than medicine. That's the real story of Dr. Darius Voss. Not the surgeon who was told he wasn't qualified, but the human being who proved that qualification has nothing to do with race and everything to do with courage, skill, and an unshakable commitment to doing what's right, even when it costs everything. Especially when it costs. Mot Fei Num Gyai.